Hi, I'm Dustin Miller. I'm Assistant Vice President for Information Technology and Services. In health IT, we have unique transactions. Compare it to banking, for example, where they just have a credit or a debit. We have a patient that comes in for a diagnosis with thousands of ways to code that, a procedure with, again, thousands of ways to code, and a medication with different dosages, frequency, and duration. We also have unique regulatory challenges around how payments can be collected and how to provide services. Those regulatory challenges keep our software vendors busy and take their attention away from increasing the usability of their software or adding new features. We provide patients with immediate access to their information through our patient portal. They can log in and update their demographic information, review their medical history, or sign up for email appointment reminders. We're also considering providing the ability to schedule appointments through the portal. Healthcare IT is changing for the better because we're using electronic medical records to improve coordination of care among providers. Electronic medical records are going to be really interesting a few years down the line when we can do studies that weren't possible on paper charts. For example, we'll be able to look at different patients with similar medical histories that had different treatment plans and evaluate the different outcomes. The rapid changes in health IT will challenge us in terms of how to store and analyze the large amounts of data that are being generated. Cloud computing will help us in terms of being able to offload the processing of those studies onto temporary cloud resources that we don't have to pay to maintain when we're done using them. Healthcare IT improves the patient experience by improving the coordination among those responsible for the patient's care. We also use health IT to get feedback from our patients. We send in a survey to every patient that has an email address on file with us every month, and we take that feedback and make improvements. We also use it to do benchmarking and model what's working.